Hi there. I'm Dr. Michael Goldberg, and we're recording this on behalf of Innovators of Health, sponsored by Redvive. Um, I am a recovering practicing dentist, a an adjunct professor, associate professor at Temple University, where I co-direct the course in practice management. And today I'm going to be interviewing Dr. Luke Bauserman, who's practicing in, I don't know if you're practicing in West Virginia or in Ohio.
Mainly in West Virginia, but a little in Ohio too.
Okay, great.
Border town,
Uh,
yeah.
Great, wonderful. And we're going to be talking today about his use of photobiomodulation, particularly the Redvive products in his practice. So, Luke, um, tell me a little bit about why you went into dentistry.
I went into dentistry. I always wanted to do something in medicine. And when I was about 21 years old, finishing up some of my undergrad classes, I thought I really should figure out what exactly I want to do. So I spent a summer shadowing as many different kinds of doctors and pharmacists and that I could. And my dentist heard that I was doing this and said, well, make sure you spend a day in my office too. And I'm sure glad that I did, because it just was the right mix of the medical side of things. I kind of have a creative artistic streak, and it fit well with dentistry. And then of course, just I feel like the opportunity to interact with patients as a dentist is kind of unique, and I enjoy that part of it. I love people.
Actually, I have a similar pathway.
Okay.
um, tell me tell me a little bit about your practice.
So my practice, so I am an owner with some partners of a dental group that's located in southeastern Ohio and West Virginia. We have four, soon to be five, restorative general dentistry locations. Um, and we have one dental sleep medicine and TMJ treatment office. My practice is in the building where we have both of those offices side by side. So I split my time about 50-50 between dedicated dental sleep medicine and TMD issues and restorative dentistry at this point. And it's been kind of a newer thing for me. It's been about 2 years that we've been growing it that way, and the dental sleep medicine and TMD is taking up more and more of my time, which is what we wanted to have happen. So it's going well. But yeah, I get to pretend to be Superman running through the phone booth there, because the offices connect through the doctor's office. So I change my lab code as I'm going through.
Cool. So, what sparked your interest in photobiomodulation?
On a personal level, a few years ago, I got my wife a red light product. It kind of looked like a sleeping bag that had some LEDs in it, to help with postpartum recovery after we had our fourth child. And she reported some really great results with that. Really felt like it helped her. And so I had that kind of in the back of my mind. This was before I really started treating TMD issues. And then fast forward to joining the Spencer Study Club, run by our mutual friend and mentor, Jameson Spencer. One of his webinars that he hosts monthly was with Dr. Desai, who spoke on photobiomodulation. And it was just kind of these dots connected for me. I'm like, oh, this thing that helped my wife has application here as well. And that was where the photobiomodulation started to enter my dental practice.
Was there a particular patient that you thought of when you connected those dots?
It with the way that it was timed, I had recently gone through the Spencer Study Club's regenerative TMD course. I'd come home, I had treated some staff members, some family members, kind of getting my sea legs a little bit with that treatment. And I was just poised to roll this treatment out as an offering for our patients, at large. And that was right when this webinar happened with Dr. Desai. And so I thought to myself, what would a fully functioning, regenerative, forward, mature TMD practice look like? And I thought they probably would be using PRF injections in conjunction with this photobiomodulation because that's what the regenerative sports medicine doctors are doing, like Dr. Desai. So I didn't have a specific patient in mind, other than I thought more of all the patients that I was going to be seeing, and how do I want to approach it. So I thought, I'm gonna try bundling this in from the ground up as I roll out PRF and regenerative medicine, and see how it goes. And I guess spoiler alert, it's going well. We're still doing it that way. We just started that earlier this year, so yeah.
So we're talking about you're using it in your sleep and TMJ practice.
Yes.
And you're using it for regenerative TMJ?
Correct.
Okay. Have you thought about using it for sleep?
Yes, we we were thinking about how to best approach that, because I one of the things that I was I guess most cautious about when it came to implementing photobiomodulation is it's good for so many things that it's easy for it to sound like snake oil if you start saying, and it's good for whatever ails you. So for me, I thought I'm going to try to roll it out for this kind of narrow application first and branch out from there. And what we found is the TMD patients respond to it really well. And then I've actually had patients that are seeing the products in the office say, well, these are dental sleep medicine patients. What's that? Can it help me? And how can I get one? And so it's kind of organically taken off on the sleep side, to where we're starting to have patients that are interested there. Also, it's starting to bleed over into the restorative practice. As I've seen patients respond well through these TMD treatments, I started thinking about mainly my extractions patients, people recovering, from full mouth extraction, transitioning to dentures. That healing period is quite the jungle to fight through for a patient. And anything that, I was thinking about how patients often elect to, they maybe want sedation to have full mouth extraction, anything to avoid pain, right? I thought, well, what if we could be doing something that's helping you avoid pain by helping you heal quicker? So that's been our most recent, newest application of the photobiomodulation. We started offering it to patients that were having extractions. We've had, I think, 2 patients that have gone through that protocol now, seeing fantastic results there too.
So explain a little bit more about the process. So you mentioned the word bundle,
Yes.
and I want to go back to that.
Yeah.
So when you present a TMJ regenerative therapy, how do
Yes.
you present it with photobiomodulation?
So I have an iPad that I have kind of a slide deck on, and I have kind of all of our different all of our different diagnoses with some imaging and our treatments on there. And so as I'm talking to a patient and we're kind of narrowing in on a diagnosis for them, I'm kind of picking what slides I want to show them on that, and getting their imaging into the slides so it's a personal presentation to them. But when I show them the PRF and photobiomodulation, is on the same slide, and I have both of those things right next to each other. On one side, I have, here's PRF. We're concentrating your healing cells and putting them where we need them. And on the other side, I have, and here is photobiomodulation. It's helping downregulate inflammation, and boost healing through mitochondrial efficiency. I have a couple other little things on there, but basically, I tell the patient both of these things together are the best things that I have available to help create conditions in your body for it to heal and recover.
And what's the patient reaction usually?
So far, really positive. Um, Patients like it. I feel like patients, some of them have some familiarity with red light therapy. It's kind of a buzzy thing right now in certain social media circles. So some of them are
Biohacking.
like, yeah, some of them are like, oh yeah, I've heard about that online, or some people it's the first time they've heard about it. And I tell them, well, you may see this if you were to go to like a gym. Some gyms have red light therapy, or you might see this in a regenerative sports medicine clinic. And I'll explain to them there's a lot of benefits to this. The reason that I'm recommending it for you is this problem that you're having, this temporal tendonitis, or whatever the nature of the problem is that they have. Um, and yeah, I wondered when I started off if I was going to have people that would request an a la carte approach, and that has yet to happen. So far, it seems to just kind of click to people that, oh, these go together. And then usually I'm presenting splint therapy, or in some cases, oral appliance therapy as the supportive therapy to the PRF and photobiomodulation. So I will say, I have a picture of a guy holding his knee, an athlete with an injured knee, and say, this guy, if he injured his knee, he went to see a regenerative sports medicine doctor. They would probably do some of these things, and he may be wearing a knee brace after that. Um, what's going to be the knee brace for your TMD condition here? And depends on what the underlying etiology is, but so yeah, we kind of position the regenerative therapies often at the forefront when they're needed, as like, this is the main treatment, and these other things we do are supportive.
I'm curious. Do you do do you take CBCTs on all your patients?
Yes.
And do you present this after looking at the CBCT and seeing whether or not there's degenerative changes in the joint?
Yes. Yeah, that's usually when we're presenting it. Yeah.
Okay.
So it's at that CBCT review with the report from the radiologist.
With the report from the radiologist.
Yes.
Great. So you have a second opinion.
A second opinion. Yeah. And a chance for the patient to see their own imaging, to say, you see this is how it's supposed to look, and this is how it looks.
Um, how is insurance handled in your practice?
We are in network for dental sleep medicine, and completely out of network fee for service for any of the TMD treatments that we do. So the
So
contracts that we have are for E0486 and K1027 only.
great. I think that's a question people will always ask. Is it covered by my insurance? I'm sure you've
Yeah,
gotten
our
that.
answer to that is this is 20 years ahead of any current insurance coverage.
Right.
Yeah.
Um, any pushback?
No,
Great.
no, we haven't really encountered pushback. Yeah.
So I'm curious demographically,
Yeah.
describe the demographics of your practice.
A
You know,
very blue
I
collar.
okay.
Yeah, very blue collar. We see a lot of patients who have Medicare. We see a lot of patients who go through the VA for their medical and dental coverage. Um, so a lot of people in that retired demographic, a lot of veterans.
Because one of the things I've heard from clients, and I'm the consultant for the Spencer Study Club, so I hear all this stuff.
Yeah,
Um, my patients won't pay for that. What do you
sure.
say? What do you say to that?
I would say, are you price pegging when you're talking to patients? Are you showing them what their alternatives are? And when we're presenting, we often are saying, hey, here's what a joint replacement procedure looks like, and this is what we don't recommend for you. Um, it's costly. On the other hand, what we're proposing for you is less than the cost of orthodontics.
Exactly.
Yeah, and then we use Apex payment solutions, and cases where the patient maybe wants to break up an expense over time, we have flexible payment plans and that. So so far, and granted, take this with a grain of salt because I've only been at this for less than a year, but it's been most of this year. Um, People have been pretty receptive.
Great. And so do you send them home with a unit?
I do. And I
Right.
think that has been a very positive thing. So as soon as they are moving forward with treatment and they're signing up for a payment plan or paying in full, even if we're not beginning with PRF injections that day, they're going home with a red light
Right.
that day.
Right.
And I
So
do
they're
think
they're accepting a program
yes,
that's inclusive. We
yeah,
a bundle, but it's a program.
yeah, exactly.
Right. Great. Um, w- for dentists who are thinking of using photobiomodulation in their practice, what advice would you give them?
I would encourage the bundled approach in some way, shape, or form, however that fits in your practice. And the reason that I would do that is I know one of my concerns when I started offering red lights and trying to think about how we were going to offer that was what's to stop the patient from getting on Timu, and finding a red light panel direct ship from China to their door for, pennies on the dollar. Um, and I find that when it's placed in an overall bundle for them, I haven't had questions about that. I guess the other thing that I've found is that oftentimes the patients have more trust of something that they're getting from a healthcare provider. Patients have asked, "So is this a better grade one?" And I say, "It is. It's the best quality one that I can get." And we get it from a company that we work with and trust. Um, but I think that at least here, kind of thinking through other retail style items. I think it's different if you're presenting it as retail versus part of treatment. And I think retail sometimes has encourages the retail mindset for that price comparison, or how can I get things a la carte.
Yeah. Are you promoting it on your website or in your marketing?
We did include some material recently on our website that kind of focuses on it in context of the overall regenerative TMD that we offer. I haven't done much of it on its own, although that is changing soon. We have a one of the Red Vive 300 panels, the larger ones that we're going to be putting out in our waiting room with a little kind of try it, over here in the chair set up for patients. So I think that will be good. Um, Going back to your previous question, what would I say to other dentists? Another thing I would add is, like everything else we do, you get better results when you're not following the fit it and forget it model. And it's the same applies here. So all of our progress surveys that we have for patients, if they're going through treatment and they're coming in for follow-up appointments, they fill out a progress survey at each appointment. We included on there, are you using your red light as prescribed, by your doctor? Are you using it morning and evening? And it's been great because there have been a few times where I'm reviewing that survey and I see that a patient isn't. So I go in and talk to him about it. And well, I get up in the morning and I'm the kind of person that hits snooze on the alarm clock, and then I'm running late to work. And so we've found some opportunities to, well, hey, let me write a note for you to take to work. Why don't you take your red light to work with you? Use it there. If your boss is wondering what's going on, you can have a note from your doctor. And
That's good marketing.
Yeah, yeah, exactly. I think that gets the word out there in all the right ways. And without a doubt, patients get benefit from this from cumulative daily use.
Yes.
And part of what is so exciting about it for me is, in dentistry, we're familiar with lasers. Lasers have been part of a dentistry for a long time. This, and to the extent that it helps heal, is kind of this democratization of some of that technology. It doesn't have to be in the hands of a licensed healthcare professional. And the advantage there is there's so much more room for this cumulative benefit without a patient having to schedule all of these follow-up appointments.
I know you touched on this before, but why did you choose to partner with Redvive?
I think it goes back to that webinar with Dr. Desai. I really appreciated all the insight that he had, the experience that he shared. And I've gotten to know him more since that webinar. I got to know him more personally. And, he's the reason that I like to work with Redvive, in addition to their products being top notch, and they have good packaging, good quality control. We've never had a problem with a single panel that we've received. Um, and how easy they make it for us to, um, you can order it and stock directly in your office. You could have it be something that is shipped directly to the patient. They've really thought about how doctors and how different practice styles work, and they mold to you versus demanding that you use a certain system that they've established. And I really appreciate that flexibility.
Um, we've talked about this a little bit. How do you see it evolving, PBM evolving within your practice?
Well, as I shared just a little bit ago, I think more and more applications on the restorative side for sure, especially in terms of healing.
Do you do implants?
We do, yeah. So I think implants, great opportunity there. We also do a lot of, in my practice, we do a lot of what I would call kind of like a functional impression style denture for patients that maybe
Okay.
can't afford, aren't a good candidate for implants. And we've kind of carved out a little niche in our local market for doing those. And so we do a lot of extractions, a lot of full mouth extractions for people. And an interesting application um, that we used it with most recently um, was so I'm sure many dentists can relate to the situation of I want to have my teeth extracted, and I'd like to have teeth immediately. There's so many patients that want that. Immediate dentures are challenging. Um, for us, when we're working through that, we're often kind of watching the clock, trying to get to that point where we can start the functional impression process so that the patient has something more than bandages with teeth on them. They have a functional prosthetic, and you have to have soft tissue healing to start that. So something that I'm kind of excited about is, usually I would find that we were waiting 8 to 10 weeks to start that post extraction for patients. I have a patient that we started that process on at week 6 that had been using photobiomodulation because his soft tissue had healed so well. Um, and that was without PRF or any other, things to help accelerate that healing process. So we're we're looking at kind of using PRF, maybe more in like a sticky bone form, bundled with a photobiomodulation panel for patients as something that they could add on to when they're having extractions done. And I'm curious to see how quickly we could get somebody to where they could start that functional impression process.
That's great.
Yeah,
So, what advice would you give to our colleagues about the using of PBM in their practice?
I wouldn't hesitate to start using it. I think that you only stand to gain um, better outcomes for your patients from doing it, and that's what it all comes down to for me. There's so many things that are marketed to dentists that, hey, just sell this to your patients, just add this in for your patients. Um, and I know I'm probably speaking for a lot of dentists when I say I I like to be more doctor than salesman, you know, and so I'm really selective about what I add in, and I wouldn't be continuing to use photobiomodulation in my practice if I didn't see those outcomes for patients. Use it yourself. Use it for something that's bothering you. You know, put it on an ache or pain that you've got. Um, I can speak personally and say that I've had uh, you know, I'm a bald guy, and the only
Didn't
negative outcome I've
notice.
had, yeah, I've the only negative outcome I've had is since I've started using red light, I have to shave my head about twice as much as I did previously because my hair is growing more. So I mean, it really does have a physiological impact when you start using it. Um, Use it for family members. I've kind of become the Oprah of red light panels in my family. You know, oh, you're getting married, you get a red light panel. You just had a baby, you get a red light panel, and you'll see the benefit in your within your family. I had a sister that her her physician was just astounded at how quickly she recovered post C-section, and wanted to know what she was doing, and it was the red light. So I think you start seeing some of those results in your life and the lives of those close to you, and then it makes it really easy to speak from that firsthand experience with your patients
Yeah,
and say, "Hey, this is something that really can move the needle in a positive direction for you."
that's great. Um, I'm curious, has your team used it at all?
Yeah, so they've used it. They asked to use it. We have some in the office, and then some of them have them at home now too. They've taken advantage of the fact that they can get a discount through Redvive, but they love them. Um, and I guess I probably would be remiss if I didn't share this story. It was in the August Spencer Study Club newsletter.
Right.
If you get that, but I had a sister that really had some really amazing, almost miraculous results recovering from Guillain-Barré syndrome as a result of using photobiomodulation, and it was yeah, to see her regain function and hope was really meaningful to me personally. I guess that's probably why that probably is the core experience that I've had with it personally that has made me, I guess, a somewhat of an evangelist for it.
Yeah. Oh, that's great. Well,
Yeah,
this was wonderful. Thank you so much for sharing all of this. I know that there are many people who can benefit from listening to your story and adopt photobiomodulation in their practices. So
yeah. Pleasure
thank you
sitting
so
down with
much,
you.
Luke.
Thank
Same.
you.